Applying for habilitation and eligibility requirements.
Habilitation, like with all Medicaid home and community-based programs, the person must meet certain eligibility criteria in order to qualify. First, the person must qualify for Medicaid. If you are not sure if your student qualifies for Medicaid or how to apply, view the Applying for Medicaid Waivers in Home and Community-Based Services snippet to learn more on how to apply. In addition to qualifying for Medicaid, the student or person must also meet at least one of the following risk factors. 1. Has undergone or is currently undergoing psychiatric treatment more intensive than outpatient care, more than once in their lifetime. So, for example, they have accessed emergency mental health services, alternative home care, partial hospitalization, or inpatient hospitalization. Medicaid describes psychiatric treatment as a condition or conditions where a diagnosis and treatment are typically provided by a psychiatrist. This does not include a primary diagnosis of intellectual disability, developmental disability, or substance abuse. However, a diagnosis of an intellectual disability, developmental disability, or substance abuse can be acknowledged as co-occurring disorders, but secondary to the psychiatric diagnosis. Substance abuse-induced disorders are not considered a psychiatric illness. Or 2, has a history of psychiatric illness resulting in at least one episode of continuous, professional supportive care other than hospitalization. This means that the person requires or has required other professional supports to manage their mental health over a length of time. This determination is made by looking at the mental health history of the applicant. Along with the previously mentioned criteria, the person must have a need for assistance typically demonstrated by meeting at least 2 of the following criteria on a continuing or intermittent basis for at least 2 years. 1. The student or person is unemployed or employed in a sheltered setting or has markedly limited skills and a poor work history. 2. The student or person requires financial assistance for out-of-hospital maintenance and may be unable to procure this assistance without help. 3. The student or person shows severe inability to establish or maintain a personal social support system. 4. The student or person requires help in basic living skills such as self-care, money management, housekeeping, cooking, or medication management. 5. The student or person exhibits inappropriate social behavior that results in demand for intervention. Once this preliminary screening is complete, verifying the student or person meets the entry criteria, a level of care assessment is completed by IME or their designee. This information is submitted as a part of the application. Remember, unlike other HCBS programs, there are no slots or waiting lists associated with this service, so services can begin right away if needed. This is an important consideration when determining what to apply for. If a student or person has a diagnosis that would qualify them for habilitation, in addition to a diagnosis that qualifies them for one of the 7 HCBS waivers, they may want to consider starting with habilitation because there is no waiting list. If services need to begin right away, it is possible to start with habilitation and then switch to a waiver program that may be closer to providing more of what is needed for the student or individual when there is a slot available. And remember, a student or individual may even be able to access both habilitation services and a waiver. Talk with the care coordinator or case manager assigned to your child or student to see if this is an option for them.
Check out our other HCBS snippets to learn more.